Hi, this is Dr. Henderson. Call me Sean, Dr. Henderson, whatever you'd like. We're going over in this video what's called an epidydymectomy. Sometimes you can get a little cyst or you can get some pain or discomfort. Most of the time it's in the head of this little epididymal tissue that sits right on top of the testicle. And so sometimes we'll go in and we'll actually take out that section, or we'll take out those little cysts. They call them spermatocele or epididymal cysts. And when we do that, we can sometimes take care of the pain. It's not guaranteed, but if we haven't tried it and we can kind of localize the pain to that area on exam, it's usually a fairly successful procedure. The procedure is done as an outpatient, same-day procedure. We can do it in a surgery center in the hospital operating room. When you get to the hospital, they'll bring you back to the operating room. It's about a 30-40 minute procedure. Usually that's maximum time. Then afterwards, it's just the recovery. If we do one side, we'll make a kind of small sideways incision or horizontal incision on that side. If we do both sides, we just make a vertical longitudinal incision so that we can pull out each testicle and take off that little area that is causing you all this pain or discomfort or bother. Once we close everything up, afterwards, the recovery is just lots of ice, lots of compression, taking it easy. You want to do ice on and off for at least the first 3 or 4 days. That'll decrease the amount of bruising and swelling that you get. Whenever I do these scrotal procedures or testicle procedures, I always tell my patients, don't see me in 2 weeks, you'll hate me in 2 weeks. See me in 4 weeks, because usually at 2 weeks you have the most swelling and bruising and it starts to calm down, so that at 4 weeks you like me again. Very successful procedure. Sometimes it doesn't take care of everything, but it's worth a shot if you have this diagnosed either on the scrotal ultrasound or on the exam in the office. Other potential complications could be bleeding, could be infection, things like that from the procedure. Everybody always asks me what could go wrong. Those are very uncommon. We always try to take care of the bleeding and always give you prophylactic antibiotics and things to take care of potential infection. We use sterile technique and sterile instrumentation. So it's a very kind of quick and easy procedure. Other things to mention here: we could potentially render you sterile if we took out any portion of your epididymis, because that is the pathway of the sperm getting out of the testicle and moving up into the ejaculate. So you want to make sure, if you're going to move forward with this procedure, that you know that's a risk, and especially if you're planning on still having children. Other than that, it's pretty straightforward and a very easy procedure for most of my patients. If you have further questions, just write those down, bring them to talk about or discuss before the procedure. But I look forward to taking care of you and getting this procedure done to hopefully help you out.